It's important to know that there are over 170 biases that exist. Whether you are conscious about your biases or unconscious about those, aware, not aware, they do exist and we all have them. And they are negatively affecting the way that you interact with your family, friends, colleagues, and the community. So, again, the series is called Outreach Overhaul, and we're going to dive into a variety of topics to help organizations and businesses staffed with community health workers, health educators, certified health education specialists, community outreach specialists, health coaches, and other health care professionals who are developing, implementing, and working towards sustainable programs or initiatives that aim to improve population health outcomes. We're going to dive in deep on how we can overhaul ineffective and generalized outreach efforts. Before we jump into the topic, I want you to know that there is a free resource guide available, our community outreach guide, to unlock the full potential of your health programs and initiatives using 6 practical tips and cost-effective strategies to enhance both online and offline community engagement efforts. You'll get it directly to your inbox. Without further ado, let's get into the topic of biases, mistrust that's occurred among communities between healthcare professionals. Whether you are a health educator or you are a healthcare professional with a medical title, there is mistrust that exists. There's a lot of historical things that has exacerbated the mistrust. We know that some has started from our childhood that we still don't even realize exists within us. There are a lot of common biases that health professionals might have when interacting with diverse communities. I'm going to talk about a couple different biases. Like I said, there's over 170 different biases that exist. Whether you believe that you have a bias or not, you do, because there's 170 of them. And I think they said about 90% of people agree that they have a bias, but I argue that 100% of us do. But some of us are not aware of those biases. So one of them is ageism. Ageism is stereotyping or discriminating against others based on their age, often happening to older individuals or team members. There was actually a report that came out in December, and employers actually admitted to wanting to hire and hiring older candidates as they assumed them to be smarter, more prepared, more skilled, and dedicated to the work. That's a very public way of saying that you have bias related to ageism and assumptions that does discriminate against other people based on their age. And so it's important for us as healthcare professionals, as individuals who are doing work that is in the community in any way, that we're not letting these different biases interfere with the bigger work that we're supposed to be doing and making a fair game for everyone and resources accessible to everyone. There's a barrier to health equity when we have this approach. Ageism can contribute to health disparities by limiting access to health information and resources for older adults. And it can be from the way that the organizations are scheduling their events, right? The day and the time to make sure that they're getting a healthy mix of individuals from the community. But when organizations are not thinking about, that's where that health inequity comes into play, because we're not thinking about the day and time that is only fit for a certain community based on age. So from the day and time to where you're organizing the event, virtual or in person. And there's a lot of assumptions that people should know how to use Zoom or Microsoft Teams by now because of the pandemic, which undermines efforts to achieve health equity within the community. My background is in chronic disease and injury prevention. And a lot of the work that I've done across the United States is really seeing how bad it is. And it's scary. It's honestly scary. In Alabama alone, chronic disease is costing $44 billion annually in lost productivity and medical costs. And with that number, I wonder how many of those individuals are uninsured and how much it's costing taxpayers to support the uninsured patients. Whether they are uninsured for a variety of reasons, it's affecting all of us. It's not affecting just those who are dealing with the chronic disease. It affects everyone. And that's that conversation I had with the organizational leader earlier today is that's the financial impact there. We're not thinking about how it just affects the organization, but we need to be thinking about how it affects us as individuals who may not directly be experiencing these things, but the community as well. It's important not to make assumptions based on age. And some of this stuff is like provide training. And I feel like that's like a gaslighting way to say we need to address these issues, but we need to be interactive in our approach when we're doing trainings and not just talk and teach to people. This was a way for me to build trust with my audience and provide some free resources in addition to insights but also encourage people to go beyond the basic training needs of our staff and our community and put hands-on approaches to things, right? That helps us to broaden our scope, our thought processes and the way that we do things so that people can learn how to actually take action on improving the things that we're working towards, not just learn and move on. Because I believe, I can't remember the statistics, maybe 3% of what we learn we remember. And people only remember the last thing you said versus a whole hour conversation that we've had. So it's important that we do hands-on approaches to when we're learning, even though that's not how everyone learns best. But when we're trying to work towards change, we need to figure out these different dynamics that can be pieced together to work towards that change. So another one is to foster cross-generational collaboration when it comes to ageism and create two-way mentorship or support through technical assistance and your team supporting different members of the community to ensure they have access to programs and resources. Again, that builds trust, that takes away the assumptions. Another bias, it's called confirmation bias, which is the tendency to seek out and use information that confirms one's views and expectations. And so they're basically cherry picking information to validate their point of view. On the other hand, the data can be right there in your face and you're not taking any action to address what the data is telling you. So if your data is telling you that there's a disparity between African Americans or the Hispanic community who are not utilizing resources, there's no reason why you shouldn't take action to address that disparity. And so I have seen it. I have worked in environments where that's happening, and it's heartbreaking. It's very sad because unfortunately, those executive leaders, they have the power to say yes or no. And when they're not looking at the data and taking that as like the truth, that is one of the biggest issues that's hard to overcome. And that's a scary truth about the disparities and inequities that exist. And so let the data tell you what's going on, but also we need to be actionable and making change that supports the data to close the gap in resources needed, whether that's education, transportation, et cetera, all those social determinants of health. And so it's important to gather multiple sources and also figure out ways to go above their head to make the change that's necessary. Because when we're just looking at one side of research to fit our narrative of our own beliefs, again, it causes those disparities within different communities of people. A lot of these government funded programs utilize research to say what programs are needed. But I honestly been working in public health for 13 years, and I still use that as a baseline to what the community actually needs. Because each neighborhood might need something different, even if they're one, zip code away from the other. Each neighborhood is different. And so when we have these community needs assessment, yes, it highlights the top 5 priorities, but that's not a blanket statement for all the communities. Figuring out which community needs what, and that kind of helps to build that trust and overcome biases. I'm not this DEI specialist who goes all in about DEI, but at the end of the day, that's what's causing some mistrust. That's what's causing gaps in access to resources. And so first we need to make sure that staff and stakeholders are fully equipped through bias and empathy training so that they can personally identify what their biases are and address it. And the interesting part about the bias training is that I don't want people telling others what their biases are, right? That would not be a good thing because we also need to address those things. It's really an internal search and being honest with yourself and having moments of thinking back when you maybe treated someone unfairly, thought something different about someone based on your biases. And even simply crossing the street because you see a homeless person sitting on the side of the road because you're uncomfortable, it's like you're treating someone differently because of what you assume. When at the end of the day, these are some of the nicest, most intelligent people who are just having an unfortunate experience. And even adding on to that, I actually do workshops for women's shelters in my local community. And you just learn so much about these individuals who are, again, in unfortunate situations. And that's why we need to go beyond the training in the workplace and put our hands-on approach to overcoming biases to build trust within communities. A lot of the times people have all the book smarts, all the degrees, all the certifications, but they haven't done the grassroots work. And that's okay, but they need to go outside of their employer if it's not happening within their employer and integrate themselves in these different experiences that help them overcome what they assume to be true, even based on research, because we know research isn't always inclusive of all races. That's a huge deal. And making sure that helps to build on what they're aiming to do within their organization and influencing change within their organization. Another thing is leaders within these organizations need to take accountability for what they're not putting forth, right? If the policy states that if you do this, then this is the outcome, organizational leaders need to stop giving so many chances and brushing it under the rug, because that creates a culture of acceptance of these behaviors that, again, it can affect the workplace. If it's affecting the workplace, it's definitely going to affect the community. We might not see that, right? We don't see how it affects the community, but at the end of the day it does, because we're, as healthcare professionals, that bias that we have, that stereotypes that we have, that might cause a delay in us providing an individual with the resource, because we're assuming, oh, they're old enough to know better. And 9 out of 10 adults are not health literate. It's really important that we're not, again, using the ageism or the degrees, or beauty bias is one, right? Beauty bias is one where we think someone looks all nice and put together. I was wearing that dress at that event last week. You could think that I have it all together and that I know all these things, but sometimes you really have to be careful with that and make sure that people understand what resources are available to them so that they can have the access that they need to improve their health outcomes. I do a complete training on this, like I said, as part of our 5-step framework on how biases can influence the quality of care provided to patients. And sometimes we know when it comes to like Black women and breast cancer, they're more likely to experience worse outcomes because of their race and gender. So those things definitely influence the quality of care provided to patients. I'll mention the steps of the framework. So one was equip staff and stakeholders through bias and empathy training. The second part is tracking performance in all of our efforts. Some people only track performance related to what the grant says to track, but that kind of isn't always the best way to go about it. I'm gonna say it's not the best way at all to just go about tracking performance based on what your grant funder requires, because we need to track our impact in a multitude of ways. It doesn't have to be this whole crazy list of performance tracking, but those key indicators that show success or attempted success in what you're doing for your programs or your services or your products that you're providing. Because we don't need to just simply depend on grants to thrive and survive for our programs and initiatives, but our partners and our communities want to see what impact that we're making so that they can buy into what we're doing and also support the sustainability of these practices. And when we're tracking performance, they can also see, hey, you're only reaching this type of community because of the day and time or the way that you're holding this event. And that can also influence ways to improve your current efforts. Build capacity is our third step of the community impact framework. How are we building capacity and funding opportunities in the way that we're building relationships with our communities, stakeholders, partnerships? How are we building capacity to sustain our efforts? So there's a lot of different ways to build capacity. That is just one, that's the category, and there's many subcategories under building capacity. The other thing, the fourth step, is market effectively. Utilizing marketing strategies, online and offline marketing strategies, to make sure we're addressing health literacy by writing in certain ways that the sixth grade reading level way, and utilizing platforms where our target audience. And again, that free community outreach guide, you'll get 6 tactical ways to enhance your community outreach and engagement efforts. And then the fifth step of the community impact framework is impact the communities. So having a real strategic approach to the way you're conducting community engagement. And organizations are focused on quantifying the cost of community engagement. And it is more clear and has been clear to me since I started my company in 2018 on ways to quantify community engagement that benefits the organization and the community and sustains the programs and resources that we have available. And I'm not just talking about funding from grants. So that is part of our 5-step community impact framework as well. I really appreciate you guys. We're going live every week on LinkedIn to build trust with our community and to provide resources. So I encourage you to download that resource that's linked in my bio. Reach out to me with questions and stay tuned for the next conversation.